Thursdays at 8 p.m. only on eNCA DSTV channel 403.
Hello again, this is All Angles here on eNCA on this Thursday afternoon. And now South Africa's medicines regulator has reassured the public that none of the substandard anti-cancer drugs flagged in a recent health study are used or sold in this country. A Lancet Global Health report raised concerns about poor quality cancer treatment in parts of Sub-Saharan Africa. That includes Ethiopia, Kenya, Malawi and Cameroon. Well, Mokhadi Fafuri joining us now from the South African Health Products Regulatory Authority, known as SAHPRA. Mokhadi, a very good afternoon. Thanks so much for your time this afternoon. And I think for anybody who hasn't really heard the story or understood it completely, just what was the issue with this medication?
Thanks, Iveka. So there were 7 substances that are for the use in treatment of cancer that were in the study, and those substances, I'll just mention the names: cisplatin, oxaliplatin, methotrexate, doxorubicin, cyclophosphamide, ifosfamide, and leucovorin are the medicines that were implicated. So all these in South Africa we do have, and we have registered under different brand names to those that were conducted in the study. And I also want to say that South Africa was not part of that study, although these substances, we've got medicines registered in South Africa and marketed in South Africa. So that study basically was indicating that they have sampled medicines from hospitals and private pharmacies, where they have tested them visually and also analytically, where they found that some medicines contained less than the actual active ingredients they are supposed to have. The others contained more, so making it substandard either way. However, in South Africa, following the alert from this study, we also have to look at what have we registered, and on those that we have registered, which ones are they marketed in the country, and of those that are marketed, we had to look back and do inventory check to say that we didn't have any reports, and then we had to look into those. But South Africa, indeed, as you mentioned, we were not affected.
Okay, so just so I'm clear, because there was a lot of medical speak, just so we're clear, South Africa has tested the drugs, these drugs that we do have, and found that they are not part of, I'm going to call a faulty batch, or that they weren't lacking anything.
Yes, you will notice that the study was over a period of time. So in South Africa, all the registered products, in terms of SAHPRA requirements, before they are released, they must be tested. So there must be a certificate of analysis and a proper release system in place for those medicines to be released for use. And because we are also importing a lot, those, when they come into the country again, they will be tested. There must be post-importation testing of those medicines before they can be released into South African for marketing purposes. And so, what I can reassure the public is that that process is intact, and all the medicines must be, before they can be used, those batches have to be tested. They must undergo analytical testing to ensure that they still meet their specification per batch. So those have been conducted, and the results were within spec.
All right.
And we haven't received any untoward adverse events regarding that.
So that was for this particular or these particular medication. Are we doing that maybe now for all is that what's done for all medication that comes into the country, including generics as well? Is there a point where we test them to see that they have everything they need to do what they need to do?
That is a requirement, and let me explain that it's not only one medicine that is implicated. These were 7 different types of medicines. Yes. So these are different 7 different types of medicines for treating cancer. And as you have asked the question whether all medicines are subjected to that, yet yes, indeed, we ensure that all the products that are coming into our country, they have to meet the specifications. Should they not, because we know that batches can fail, there is a system in place, the alert system and recall system, whereby the regulator together with the manufacturer or the applicant or the holder of certificate of registration, where we will therefore discuss the way forward, weighing the benefit versus the risk, because always we want to make sure that the public is safe before that medicine can be utilized. So you would notice that we do a lot of alerts and also withdrawals or recalls of medicines which are, especially the batches which are not safe. We will recall those and alert the public and the medical professionals accordingly.
Mokgadi, just very quickly, if you can tell us, I mean, people are probably wondering what has happened to those who actually did take this medication in parts of Sub-Saharan Africa. We had countries like Ethiopia, we mentioned Kenya, Malawi, Cameroon. We might have family there. What happened when they were given this medication? What was the result?
Remember, we were not part of the study, and therefore, as a regulator, we were also not informed. But ordinarily, the relevant regulators in those countries would be informed, and also all the regulators have got alert systems, whether for reporting of adverse drug reactions or adverse events relating to medicines. There are systems in place for every regulator for reporting of those, where the regulator will therefore take necessary regulatory actions for investigating those. And therefore, there are different outcomes that can come from that, whether it was just that batch. But the reason why we are testing, we are requiring that every batch be tested, is because you want to make sure that every batch is safe for public use, and only adverse events are coming from additional information, but not because the medicine did not meet the requirements. But what we also have in South Africa, we have got we also have post-market surveillance, sampling and testing for risk products. So we classify products according to risk, and therefore we sample them and test them.
All right, well, that's good to know. Thanks very much for putting us at ease about that one. SAHPRA Regulatory Compliance Manager Mokgadi Fafudi. Yeah, well, it is a busy day indeed. Lots going on.
Yeah.
and especially there in Nabila Sheikh in Braamfontein and in Kosikona in Durban.
Yeah,
Things
more
are
on
heating
that
up,
at 1 o'clock. Yeah, stay with us. Busy news day.
I've met a lot of people who saved on their car insurance premium without insurance lately. But what if you don't save? Well, you still get something out. Yep, you can ask for 500 Rand cash in your bank account